Coming up right now on The Doctors, where MD meets TV.
Coming up, something every parent must see. What if your child wasn't able to fight off the common cold, a stomach bug, or even a mild fever? You'll meet a family who faced this very issue, plus the groundbreaking surgery that may save their child's life. It's all next.
Initially, we're perfectly normal, but he had this slight twitch. I realized that there was actually something wrong with my child. These children generally die before their second birthday.
Having a child is one of the most precious moments in a parent's life, but what would you do if you found out your child was basically born without an immune system and was not able to fight off diseases? Well, for Erica and Josh, this nightmare became a reality when their son, Silas, was diagnosed with a congenital disorder called DeGeorge syndrome.
My son is 7 months old, and he is one of the happiest babies. Silas has not only a cleft lip, but also a cleft palate, and we saw he had this slight twitch. I sort of just brushed it aside. Come here. A few hours passed and it happened again. I realized that there was actually something wrong with my child. In the emergency room, they kept running test after test, and every test that came back was normal until they noticed that his white blood cells were low. It ended up being DeGeorge syndrome. And if you don't do anything, these children generally die before their second birthday. Dr. Markert told us that she offered the thymus transplant and she thought it was a good option.
The thymus is critical before you're born to fill up the body with T cells. And a baby, when the baby's born, has twice as many T cells as you or I.
Silas' life is very different from most children because if he were to interact with other children and they were to bring any illness to him, it could have potentially fatal complications. Anyone who touches my child other than my husband and I has to put a gown on top of their clothes, wear a face mask, and put on gloves. I am afraid that he's going to contract some illness before he's able to fight it off on his own. Children with DeGeorge syndrome, there aren't very many who made it out of their teenage years, so we really don't know what the long-term prognosis is going to be. Only time's going to tell.
Erica and Josh took Silas to Duke University Medical Center for a groundbreaking immune suppression and thymus transplantation to save their son's life. Headed by Dr. Louise Markert, Duke is the only center to offer thymus transplantation as a cure for this immune defect. Joining us today is pediatric immunologist Dr. Danica Schulte from Cedars-Sinai Medical Center. Thank you, Dr. Schulte, for being with us.
Thank you.
And touched upon in the video what DeGeorge syndrome is, but explain to us in layman's terms what it means.
Sure. DeGeorge syndrome occurs early in fetal development. It's a group of signs and symptoms like heart disease, immune deficiency, low calcium, facial abnormalities, cleft lip, cleft palate, like Silas, typically from a defect in chromosome 22. There are kids, like we were talking about, with partial DeGeorge syndrome, those kids that have maybe some of the signs and symptoms but not the severe immune deficiency, and complete DeGeorge, like Silas, without a thymus, who has that life-threatening immune deficiency.
Why is the thymus so important?
It's the sort of the education center for your immune cells, the cells that fight infection, those common colds, the bacterial infections that kids are exposed to all the time. So the thymus is key to your immune system, and without a thymus, you can see that there are severe immunodeficiencies. The transplant was developed by Duke University, Dr. Markert, and what they figured out is that these babies that have cardiac defects, heart defects that need surgery anyway, to get to the heart, they have to go through the thymus. So Dr. Markert was saying, wait a minute, here's the thymus, we can actually use this, we can culture it, we can give it to babies without thymus and really create a healthy immune system for them. And she's successfully done this about 73–75% of the time. She's very successful. There's a heart, and in front of the heart is the thymus tissue. The thymus is removed, and very small sections of thymus are placed in the thigh, allowing for blood flow, and hopefully T cells, your immune cells, develop and are able to help fight infection.
And usually someone gets a transplant and they have to have their immune systems obviously suppressed from that. And this is such a unique procedure because you're trying to give someone an immune system,
right, true.
at the same time suppressing...
But because it's not their organ, it's an organ transplant, they have to go on immunosuppressive
They do
medication.
early on, right, absolutely, so that graft, that outside thymus taken from somebody else, put it into their own body, isn't rejected. So they go on immunosuppressive medication early on. And from what I'm told, Silas is now off of that immune suppression and really doing great.
It's amazing life-saving surgery.
Absolutely.
It is. And coming up, Erica and Josh are going to fill us in on how Silas is doing after the procedure. Plus, we go inside the surgery itself that transformed his face. It's all next.
One of the things you have to do is be very accurate about the anatomic landmarks of the lip so that you can put everything back together just the way it was intended to be.
The following program contains images of an actual surgical procedure. These images are graphic and may be disturbing. Parents are advised that these images may not be suitable for young children.
Raleigh, thanks for watching us. Now, I've got a prescription for you. Don't miss Dr. Phil tomorrow morning.
See how their remarkable journey can change your life.
I am through with him.
For the first time in my life, I like who I am. How do you feel now?
It's just wait.
Dr. Phil tomorrow at 9 on WRAL. As doctors, our hope is that every child is born healthy, but for Erica and Josh, this was not the case. Their son Silas was born with the George syndrome. It's a condition that makes it almost impossible for him to fight off infections. Luckily, Duke University Medical Center was able to offer Silas a groundbreaking thymus transplant surgery. It's been 9 months, and we have Silas's parents, Eric and Josh, on the phone to get an update. Welcome to the show. How are you?
We're doing great. We needless to say had a rough year last year, but we're finally at a point where we see the light at the end of the tunnel.
So how is Silas doing?
Silas is doing great. The biopsy last fall, Dr. Markert came back and said that it was just beautiful. The tissue was not rejected, and little T cells have gone there to go to school and learn how to do their job.
Oh, that's great. Is Silas able to do some of the things now that he wasn't able to do before?
Yeah, at this point he is able to see some family, he's going places, and we don't have to be nearly as strict with all the gowns, gloves, and masks.
He's developing normally and hitting his milestones.
That's fantastic. And I touched upon this earlier. Many times facial features are also a part of this syndrome, and Silas was born with the cleft lip and palate. He underwent a dramatic surgery to repair this problem.
This little boy has a unilateral complete cleft lip and palate. And what that means is that the cleft extends entirely through the lip and also through the gum line. And one of the things you have to do is be very accurate about the anatomic landmarks of the lips so you can put everything back together just the way it was intended to be. And I'm going to actually short that just a little bit right there just because I think we'll be able to get that to come in a little better. This is the muscle layer there. I like to leave just a little bit of muscle that'll stay with the lip, so I'll make a small cut in there that lets that drop down. We're going to work our way outside, so we start with the places that are hardest to get to, and then we finish with the places that are easiest to get to. He'll come back next week for removal of the stitches. And in the meantime, he'll spend the night here. Kids do amazingly well with these procedures. That's it. That's how you do it.
Dr. Marcus at Duke performed the cleft lip surgery that you just saw on Silas, did an amazing job. And Erica, how is Silas doing after the repair?
Silas certainly, he looks completely different. I had a lot of hesitation going into this surgery because I had had so long to get used to his face. but now he's gorgeous. He is completely gorgeous. He does not look like the same child at all.
And we're looking at pictures of Silas before and after in the studio. I think everyone here is amazed at how wonderful
he's
he
looking
looks.
great. He's really cute.
And kudos to Dr. Marcus for doing such a great job.
Something that we do as plastic surgeons, they really did a beautiful job, the cleft team, Dr. Marcus at Duke. And one of the big things, you can see the nose was affected seriously with this clefting, and at the same time he was able to repair the nose. And typically the timing, you do the lip first, followed by the palate later on, and really a wonderful result.
Do you have a few questions for us?
Yeah, more for Dr. Schulte. We have a concern that coming down the road he might catch colds more often, or if he's going to have to deal with them longer than most kids.
Absolutely. With his immune system, it's very important to monitor his blood counts, make sure those fighting white blood cells are there in adequate numbers. He will be a little more prone to common colds, but remembering that babies his age get colds. He might take a little bit longer to get rid of these colds and other infections he may get, but it's par for the course, I think, for a 15-month-old.
Because early on, it's really isolation is so important to prevent infections from occurring, but down the road?
Absolutely. It's important early on because he's on the immunosuppressive medications, those medications that keep a lid on his immune system to allow that transplant to grow. And like Mom was saying last fall, they evaluated the transplant. He's making good T cells, great fighter cells. So he's doing what he needs to do to get better. And over time, he's going to have friends like everyone else. He's off that medication, and it sounds like he's doing great. So very optimistic. It's a great story.
Thank you so much. And Erica and Josh, thanks so much, and give Silas a big kiss from all of us.
Oh, absolutely. Thank you, guys.
He's a special little guy, and we also want to thank Dr. Danica Schulte for helping us out today and answering their questions. Thank you so much. Coming up, we're going to give you more tips to keep you and your family healthy, my doctor's orders.